Welcome back. You know, if you or someone you know has hereditary cancer syndrome, a local institute is working to help you learn more. Cassie Greganis, a certified genetic counselor at USA Health Mitchell Cancer Institute, is here with us now to talk more about this. Thank you so much for stopping by.
Thank you so much for having me. I really appreciate it.
Absolutely. So first things first, for those who are tuning in and they maybe don't know, what is a genetic counselor?
Yeah, so a genetic counselor is an individual who has a master's degree in genetic counseling who is then certified by the American Board of Genetic Counselors. And what a genetic counselor does is they help individuals and their families and also their providers understand their genetic test results and more about their genetics and how that plays a role in cancer.
Genetics play a factor in so many things. Can you elaborate for us, please, on hereditary cancer?
Yeah, so a hereditary cause for cancer is just that. It's a genetic cause for cancer. We know that most cancers actually happen by chance or due to some sort of environmental factor, but in about 5 to 10% of cases, cancer is actually caused by a genetic factor and not by chance.
So in terms of the signs, because we know when it comes to cancer that early detection is key for treatment, is there a way to know, or is there something to look for, or is it just starting the conversation?
Yes, that's a great question. And I do want to say, you know, February is National Cancer Prevention Month. And so this is really important to be talking about with your families at this point in time. And so some things that you can look for in your family are things like cancer diagnosed at a young age. And what we consider young is less than 50. So anybody diagnosed under the age of 50 with cancer, anybody having 2 or more cancers, so maybe a breast and an ovarian cancer, or breast and colon cancer, having multiple cases of the same cancer on one side of the family. So say you have, you know, multiple maternal relatives with breast cancer or breast and ovarian cancer, and then also looking out for certain rare cancers such as ovarian cancer, also pancreatic cancer, and then even rarer cancers such as medullary thyroid cancer or a sarcoma and things like that.
Now, just because there is that in your family, in your genetics, it doesn't necessarily mean, right, that that's going to be your story. What should someone be truly concerned with in terms of their family history where this is regarded?
That's right. You're completely correct that just because you do have these signs or kind of red flags of a hereditary cancer syndrome doesn't mean that there is one in your family. And so what we would recommend that a person do is sit down with their family and talk about that family history, get detailed history if they can, and then take that to their providers, their primary care physicians, or to their OBGYNs or other physicians and say, hey, I have this family history of cancer, you know, I'm kind of concerned. Then they can evaluate that and say, you know, actually we are seeing some of these red flags. Maybe you should go talk to a genetic counselor who can then sit down with you, you know, talk you through all the red flags, talk you through why genetic testing might or might not be a good idea for you or your family members, and really talk with you about that testing and about how to move forward.
Well, thank you so much for stopping by. Appreciate the work that you guys are doing.
Yes, thank you so much.
And you can watch this interview again, share it with someone you know who may need the help. Just head to our YouTube channel shortly after this newscast. We'll have it posted, and subscribe. That way you don't miss those alerts when the story is uploaded.